Slide 1. The disease my group was given is called Acinetobacter Baumannii by Ali Kendall, Zach Walker, and Alexis Flores. The name of the causal agent is Acinetobacter Baumannii bacteria. The year that the causal agent caused the disease is 1968. The annual incident rate in the United States was 621 cases and 537 patients. Among the 598 cases for which complete data were available, 528 occurred among patients with exposure to the healthcare facilities.
Acinetobacter is an obligate pathogen. It's also an opportunistic pathogen. This is because it will strike a patient when their immune system is already compromised. This happens mostly in hospitals because there are many immunely compromised patients already there. The symptoms of this bacteria come from infections to the blood, urinary tract, and lungs. These infections can cause symptoms of fever, coughing, chest pain, or even a burning feeling while urinating. A patient can also be asymptomatic while the bacteria still colonizes or lives within the patient. Patients being asymptomatic can also make it spread to other patients more easily. Acinetobacter has a growing antibiotic resistance. This can lead to lack of therapeutics, long hospital stays, or even higher rates of mortality. This leads me into the section of the risk of death. When in children, it becomes more serious. But also, when it enters the bloodstream in any patient, it becomes a major concern. This is because it poses a chance of infections within the blood. The people most at risk are people on ventilators, have open wounds after surgeries, in extensive care, or people who have weakened immune system. Healthcare professionals are also at very high risk because they are constantly working around people with this virus. The first case of Acinetobacter was spotted in a hospital within China. Each patient was already in critical illness with an endotracheal intubation and an endotracheal aspiration. The major impacts of this outbreak reminded healthcare professionals of proper hand hygiene and PPE use. This pushed them to learn more about transmission and environmental cleaning and equipment reprocessing, forcing them to become more familiar with the characteristics of Acinetobacter made them more aware of the symptoms and able to catch it.
Acinetobacter Baumannii is a bacterial pathogen, and some of the characteristics of this pathogen are that it's gram-negative, aerobic, and catalase positive. And then some of the virulence factors that make Acinetobacter Baumannii kind of what it is that it has a OMP-A protein. And this OMP-A protein has different functions that it allows it to do, such as that it binds to the epithelia and mitochondria of a host and will lead to apoptosis of the cell. Another factor that OMP-A helps in is the stability to form biofilm that will allow it to grow in unfavorable conditions. And then a couple of the other different virulence factors are that it has an ability to adhere to surfaces, display antimicrobial resistance, and its ability to acquire genetic material from unrelated genera.
This slide talks about the prevention of disease, diagnosis of disease, and treatment of the disease. Our disease can live on the skin and may survive in the environment for several days, which makes prevention of disease very difficult. Careful attention to the infection control procedures such as hand hygiene and environmental cleaning can reduce the risk of transmission. The diagnosis of our disease is made by the growth of Acinetobacter from a patient specimen through blood or other body fluids in the setting of other clinical findings that suggest an infection at the site. The antibiotics are usually effective against Baumannii. Infections include carbapenems, polymyxins E and B, Sulbactam, piperglycin, tazobactam, tigeaglycin, and aminoglycosides are the main treatments for this disease.